On. All right. Hi, everyone, and welcome to my lecture on Above the Net Success. It is a lecture workshop. I am Vanessa Chu, and I'm a physical therapist here at UCSF Benioff Children's Hospital, Oakland. And I wanted to tell you a little bit about the hospital.
There will be a test of the group alert pager. If your unit does not respond to the test, please notify the operator.
Sorry, I clicked out of it. There you go.
There will be a test of the group alert pager.
There you go.
If your unit does not respond to the test, please notify the operator. Thank you.
Sorry for the live web audience at home. We had a little overhead page, so I was waiting for that to be completed. So we have our 4 campuses here: Oakland, San Francisco, San Ramon, and Walnut Creek. Our newest one is San Francisco. We've got lots of wonderful departments here at the Oakland campus. Our orthopedic care center, we've got sports physical therapy, we offer athletic training. We've got lots of athletic trainers all over different East Bay high schools. We've got a dance medicine program as well that we offer all over at the different campuses. And we also have a wonderful sports concussion program, and I'm one of the treating concussion therapists here. At Walnut Creek, we've got motion analysis and a sports performance lab, and Chrissy is the lead tech woman for that. We work with our registered dietitians here, and so we are a really great comprehensive team. And here at the Oakland campus, this is going to be our new beautiful outpatient center that you can all see that's getting built outside, which we aren't a part of. We're going to stay in our cute little trailer. But again, we've got some of the departments listed here. And I think the completion date for the building is 2025. Is that right?
I think for the full campus.
For the full campus, it will be about 2025. And again, a little bit of a list of our some specialty services that we offer within the Sports Medicine Center for Young Athletes. We have the comprehensive rehabilitation of sports injuries. We've got physical therapists at every campus that I've listed. We do sports training, individual sports performance. And we also offer injury risk assessment and injury prevention clinics. And we are a dedicated pediatric practice. And a few more excellent points about our sports medicine. UCSF Benioff Children's Hospital Oakland Sports Medicine Center for Young Athletes is a specially designed facility dedicated to the care, treatment, and education of young athletes in the Bay Area. And we are the largest pediatric sports medicine facility in Northern California. And one of our objectives is to really look at a child's quick and safe return to sports and continuing to educate families, parents, coaches, teachers regarding proper sports performance and proper nutrition and rehabilitation for any athletic injury. And again, we've got our 4 campuses that I've listed, and since 2004, we have worked exclusively with young athletes to manage, rehabilitate, and prevent sports injuries. And the young athlete population is a bit different from dealing with a skeletally mature adult. So since there is a lot of differences with going through all these different developmental stages, you have to treat these young athletes differently than an adult. And so that's why we have our specialty here at in the Sports Medicine Center. And so I have here one of my favorite pictures of a baby giraffe. So I always think, here's this tall creature, and they are growing at such a fast rate, and they're just a little awkward with their legs. They don't have the proper footing at times, and a little klutzy, and not to call anyone out, but Ashby here, did you kind of go through that with growing?
Definitely.
And so for people at home, I have a former patient of mine, Ashby here, and she's going to be demonstrating a few different exercises and different movements, and she's a varsity volleyball player at Bishop O'Dowd. So with my baby Giraffe, my point to the picture was that their proprioception is a little off. When you're at the same height, I've been 5'2" for I think 18 years. It's kind of sad down here. But so I know my body. I've been 5'2" for many, many years. But if you're growing at a fast rate, your body is still trying to get used to where you are in space. And that's how you can almost have a little kind of klutzy complex, if you will. So some statistics on volleyball. There's more than 460,000 high school students that participate in interscholastic volleyball, and I think that stat is actually on the low side. I think it's higher now. According to a 2012 survey, this is the third highest sport for female participation at a high school level, which I think is super, super awesome. And actually, if you do the stats of looking at all the different sports, volleyball actually has one of the lowest injury rates compared to the major sports. That doesn't mean that injuries don't happen. There's still, of course, lots of traumatic and overuse injuries that do take place with volleyball. And so I feel like when I wrote this out, both strength and flexibility are important for helping to reduce the risk of injury with volleyball. I feel like you can erase volleyball and you could pretty much put any kind of sport or activity there. That it really comes down to a proper balance of your strength, your stability, along with your mobility or flexibility of your muscles and tissue. And so with volleyball, there's definitely a lot of different body parts that can get affected and injured. I know, have you ever had anyone out there in the audience had a thumb or wrist injury before? I see some nods, wrist. But how many have had an ankle injury before from volleyball? Yeah, okay, yep. How about knees? Anyone's had a knee injury? Okay. And how about the back? Bye. And the shoulder, how about the shoulder? Okay, so I think these are going to be the four that I'm going to address here tonight, but there's definitely other parts of the body that do get involved. So I don't mean to neglect them, but just for sake of the lecture, I'm going to focus on these main four. So let's go back to that ankle sprain. When you look at this picture, if you think back of when you've had an ankle sprain, what are some signs? What happens when you have an ankle sprain? Yeah?
It swells up.
It swells up. Definitely does. It balloons out. There's a lot of swelling that goes to that area. What else happens? What else do you see in the picture? Yeah, bruising, some discoloration too, definitely. And it's definitely painful. So in volleyball, ankle injuries are the most common acute injury. It's about 30% of injuries. Hi guys, come on down, grab a folder, sign in. And ankle sprains usually occur at the volleyball net when player is coming down and lands. They can land on a foot of an opponent or a teammate after blocking or attacking the ball. That doesn't mean that's the only time it happens. I'm sure it can happen at any moment of cutting, pivoting, and just some type of poor movement that took place, okay? And players are at greater risk for injury within their first year after spraining the ankle. So normally what happens is that I've got an ankle here. So this is a right foot here, big toe, pinky toe. So you guys are looking at the outside of the foot here. Majority of sprains are where the ankle is rolling out laterally, and these structures here on the outside will get torn or loosened, okay? And so if that happens, there tends to be a little bit of what we call a laxity at that area, so there's a vulnerability. And once there's a laxity at those tissues, the ligaments, then there tends to be more of a vulnerability to having another ankle sprain occur. So I want to be careful with this where I said prevention, external support, brace or tape. I don't want to give the feel or message that bracing or taping is going to prevent. We know that if I brace or tape something, it's not going to prevent me from re-spraining it. But I definitely would recommend you could put an ankle brace on if you did sprain an ankle and you're going to have to go back, and it's not too bad of an ankle sprain. You feel like you can go back and play. You don't want to be wearing a brace there. And taping can feel supportive. So it's more of how you feel, but based on evidence and studies out there, there's nothing that concludes that bracing or taping could prevent it, okay? But definitely good shoe wear. And this isn't just shoe wear that I'm talking about when you're playing volleyball. This is if you're going out and you've got, let's just say you have flat feet and you don't wear supportive shoe wear. You definitely are setting yourself up to having a foot or ankle injury with that, or high heels, anything like that, right? Right, Chrissy? And exercises can definitely help stabilize the ankle. And we'll get into some more exercises further down. Okay, so let's talk about the back. So usually with volleyball, it tends to be a soft tissue injury. So we're talking about either muscle or a ligament strain. Ligaments, a lot of people hear ligaments and tendons and not too sure what's what. Ligament is the tissue that connects bone to bone, and tendon is what connects muscle to bone. So usually with volleyball, the injury tends to be to soft tissue. It can also be from overuse. I was just speaking with Ashby about big tournaments, and she was telling me that sometimes you'll play, is it 11 games? You can play up to 11 games, and you're just spending hours and hours. That can be overuse in a short duration of time, over like a weekend, right, a few days. Or it could be overuse and not resting. So you're playing and playing for months on end and not resting properly. Lack of proper conditioning. This could be getting other strengthening, flexibility, other components that are outside of just playing volleyball. Insufficient stretching, I think that speaks for itself, with not being able to stretch afterward and losing flexibility, which is going to prevent you from proper movement mechanics. Or it could just be a trauma to the back. So, postural syndrome, what I mean by that is improper body mechanics and technique while passing, setting, hitting, or serving. So with most athletic injuries, this happens with dance, swimming, anything where you have a movement taking place. You could, if you're going through your movement pattern improperly, you can then, of course, cause an injury. If I'm not serving properly and I'm doing something where I'm hiking my shoulder or tipping it forward, anything, that can cause an injury, or just the overuse aspect of, you could have the best technique in the world, but if you're just wearing and tearing and not allowing your body to rest properly, then you're going to be vulnerable to an injury. And this also is a risk for developing a stress fracture. So a stress fracture is a small hairline fracture that takes place at a bone. I'm specifically talking about the spine right now, and the one in the spine would be called spondylolysis, but stress fractures can take place in other parts of the body. But that would probably be, out of everything today, the most serious that I'm going to discuss. But again, this is a little bit more on the rare side compared to more of the strains that can take place in the back with volleyball. So to go a little bit further in depth on the stress fracture, there's a certain type of a stress fracture called a fatigue fracture. I'm going to take a little water break. So it's exactly what it sounds like. Fatigue is talking about a small break, and then, or sorry, the fatigue is the tired part, and that you're overusing, and a fracture is the some type of a break in the bone. So some signs of a fatigue fracture would be hypertonicity of the affected area. What that means, that's a big word, hypertonicity, is that the muscles at that segment could overdevelop. So if I'm looking at the big paraspinal muscles that run down the spine, it could almost feel like a speed bump that comes out. So that's telling me something at that segment is going on there, where there might be some type of instability, some type of injury that these muscles have developed right at that area. Tends to present just as a dull ache in the back, and it could present as either unilateral or bilateral. Unilateral means one side, or it could be bilateral, both sides. This, as I said, it can be caused by repeated overload to the back, so then the bone will break. Then the bones are also vulnerable too, because we are dealing with a young athlete, a child, adolescent, teenager that's growing too. So there's vulnerability. So definitely parents, coaches, teachers out there, you need to take it seriously. If your child, teenager has an ache in the back, we need to see how they're doing and how they're, is this going away in a few days, like a strain? Is it getting worse? They may need imaging. So take it seriously and take them to the doctor for sure for further assessment by a physician. And I think I covered everything there. So for treatment for this, we want to stabilize the spine, and we want to make sure that we've got strength and activation of our core. So when I say the core, what exactly do I mean by the core? It is not just this big six-pack abdominal muscles right here in the middle. I've listed here, we're not going to have an anatomy test at the end, but I've listed a lot of the muscles that are a part of the core. So this is everything around their torso. You've got back muscles that are really tiny, and they originate and attach segmentally through the spine. You've got muscles through your thighs, the quads, hamstrings, the inside leg, your adductors, pelvic floor. Everything through here is my core. So that's what I mean when I say that term. So these muscles help maintain postural control, and they are providing stability proximally speaking. The term proximal means towards the inside of your body versus distal is away. They also help with strength output, as well as maximizing efficient athletic performance. So that means you're going to be moving faster and jumping higher, which is what it's all about with volleyball. And so I love this picture of the tree. So of course, in the middle here, we've got the trunk. And it's really, really big and thick, and that's just creating such a nice, firm, solid foundation. So when nature hits of rain and wind and storms, these branches have a nice foundation. And so when I say proximal stability, I'm talking about the trunk here for distal mobility for the branches. So if we don't want a wobbly tree where this trunk here is just kind of thin and it's not holding strong, you're going to have, this tree's going to collapse down. So this is what we want. So there are some advanced strengthening to help strengthen your core. I've got some of the pictures here, but there's also in the folder, I've got a bunch of exercises on one page. Can I grab that from you, Ashby? And so it's this page here that I'm going to go through a little bit later, but some of these are giving examples of, thank you, higher level advanced core activation work. And next, I'm going to move on to the shoulder. So we always hear the term rotator cuff. So what exactly is this rotator cuff? We've got 4 muscles that create the rotator cuff. Then they're listed there: supraspinatus, infraspinatus, teres minor, and subscapularis. And again, you don't have to memorize this, but the main purpose of the rotator cuff is it's trying to keep the ball in the socket here. And you want to get this nice suction. Now, it doesn't, the shoulder is an interesting design because it's not this beautiful bowl where you've got the ball in the socket and it's going to be nice and stable. Picture more of like a golf ball on a tee, and that's more of how the shoulder is designed. So there's a lot of connective tissue, the labrum, the capsule, and the rotator cuff that encompass the whole shoulder. And since it's such a complex joint, it is very vulnerable towards injury. And of course, what's volleyball? You've got a lot of overhead movement with serving, blocking, setting, and so there's a lot of load on your shoulder. So you can sustain a rotator cuff injury simply, again, by overusing your shoulder. And these muscles can get irritated or fatigued with overuse. And in some cases, the muscles and tendon can tear. So not only is the rotator cuff vulnerable to injury, there's other structures like I listed, especially the labrum. The labrum helps increase surface area for that socket. And the labrum goes around, and that can get torn. And there's also dislocations can take place where you have excessive movement and the shoulder can actually pop out, or subluxation where it pops out a little bit and pops back in. That's an instability where there's excessive, too much range of motion that's taking place at the shoulder. So all of these can then compromise the rotator cuff and how it's working and functioning, okay? So you need the rotator cuff for generating power and force while serving and hitting the ball during practices, during games. And in conclusion with the shoulder, I would also definitely get it looked at if you do have ongoing shoulder pain, pain with going over shoulder level, go see a physician for sure. So moving on to knee pain, I think almost everyone had their hands up with dealing with knee issues, some type of knee injury. I have here listed the terms knee tendinosis and tendinitis are the most common overuse injury. A lot of times we hear this tendinitis, tendinosis. What's exactly the difference? The term tendinitis tends to infer an inflammation or an inflammatory state. The tendinosis is more of that wear and tear that occurs. So pain is usually located right over the affected area. So it's a great way for us to assess is that we'll be poking our fingers around and we can hit the tendon and they have pain directly over it. So I've got here the knee, and this is a right knee. So we've got your thigh bone here. I don't know if it's on the camera, but you've got your thigh bone, and then you've got two bones in the lower leg. The outside one's the fibula, then you've got your tibia. Then here's the kneecap. So a lot of times, volleyball players, since it's a jumping sport, can sustain what's called jumper's knee. And what jumper's knee is it's affecting the patellar tendon, okay? So the quadriceps is the big muscle up here, your thigh, and as it comes down, it becomes the quad tendon, and then you've got your patellar tendon. So when people say, oh, I'm having pain right here, that tends to be the jumper's knee or patellar tendinitis. And knee pain can occur secondary to poor passing position and or repetitive, forceful jumping with hitting or blocking. So aside from the jumper's knee, there's a lot of other different diagnoses, and I could literally spend a whole lecture talking about knee pain. Another issue that I see very common that I didn't list here is patellofemoral syndrome or patellofemoral pain syndrome. What that means is an athlete having a tracking issue where the kneecap is getting pulled out laterally by your IT band structures out on the outside of the leg. And it's not just this tissue getting tight and pulling the kneecap out laterally and having poor tracking and alignment in the groove. It's also the femur. So picture a train on train tracks. This is the train here, and then we've got the train tracks. The train tracks here are a little tilted. What does that come from? It could be something structural of how you're just built, or it could be something happening up at your hip where these muscles here are weak, and that's throwing off how your knee is properly moving and functioning. So the knee tends to be kind of the lost middle child in between the ankle and the hip. So if you've got ankle and hip issues, it can come out in your knee. So jumping. Volleyball is the sport with the highest jump rate. And there was a study that found that out of 106 patients treated for volleyball injuries, 63% of the injuries were from jumping or landing. And so for proper landing techniques while jumping, we want to have, I think everyone could really visualize it in their head of what a proper landing technique looks like, but I'll talk through, and Ashby, did you want to stand up for a second? Okay, so I'll talk through it, and then you can show what a proper landing technique looks like. Do you want her on the camera?
Do approach or just straight up?
You can do the approach and then show what your land looks like. So Ashby's going to show what the full cycle. Go ahead. You can show it. And then she lands. So when she landed, just to break down what she just did, her hips are back, her knees are bent, and her knees were not going over past her toes. That's really key on the knees. And she doesn't have her knees landing inward. They were landing forward. Also, you guys did not feel an earthquake. She landed soft like a feather. So I wanted to touch base on proper warming up. So I don't think, oh, you're good. I really don't think anyone would go to like a Bikram yoga class and try to be stretching out all their muscles right before you're going to go play a volleyball game, right? That just, I hope that doesn't sound right. The reason why you really shouldn't be going into long static hold stretches right before you go into a sport is that you're taking, let's just think of a rubber band, and you're putting that, the rubber band was in the freezer, and then we just took that rubber band out, and now we're going to be stretching it out and just holding it there. That's not the way we want to approach that rubber band. If you took that rubber band out of the freezer, don't you want to kind of play, pull, contract, relax it a little bit, and then it will slowly ease up and thaw out, and then it will move. So that's what I'd want for my athletes, is for them to properly warm up. So here at Children's, I think every single patient knows our dynamic warm-up, and these are some, warming up could be anything. It does not have to be this list here, although this list is awesome. But it can be anything where you are just moving. You're not doing a static hold, okay? So Frankenstein walks. Do you want to show Ashby again? Frankenstein walks are to help warm up the posterior chain, her glutes, her hamstrings, and calves. So she is doing just a kick up, and she's got her toes up to the ceiling. Her legs are straight, her knees aren't bent, and she's feeling a stretch just in the back there. The next one is a knee hug and a calf raise. So she's bringing her knee up towards her chest. And for those in the back, she's actually going up onto her tiptoes into what we call a heel raise. So she's getting a nice stretch at her hip, at her glutes, and also getting her calf warmed up there. The third one listed are lunges. So she'll go into a lunge, her hips are forward, her knees are not going over her toes. Those are beautiful lunges there. And then she can come back, and again, these are warming up her leg muscles. Also, she's working on activating her core. This is also dynamic balance for her. Her favorite one, everyone's favorite, inchworms, and actually in the picture on my PowerPoint, that's a little inchworm. So what she does is she's tiptoeing her feet up, and then she's walking her hands out. So her hips are coming up towards the ceiling. She's trying to get her heels down to get a nice stretch in the back of the leg, and she's walking her hands out. With that, you don't have to do it. With that also, she's also warming up her upper body too. So she's putting a lot of weight through her arms and her shoulders. And a lot of times my kids will say, oh, I feel it in my arms, not their legs, because they've got to work on their arm strength. The fifth one is high knees. So now we're getting into a little bit more plyometric, more impact. So she's just bringing her knees up to hip height. The next one, the sixth one, is butt kickers. So she's trying to kick her butt. Nice little quad stretch for the front of her legs here. And then next, we're introducing lateral movement. So she'll do a side shuffle or a lateral shuffle, get nice and low, good squat position, her hips are back. And then the last one is back pedal. So just a quick jog backwards. That's the dynamic warm-up. And I think I did also include that in the folder. If you didn't get a folder, there's a bunch over at the front table at the entrance there.
Apologies for this. We'll get there in a second.
So listed are the exercises that I was talking about on the paper. Some of these exercises that I have listed are excellent for the glutes. So the bridges, as pictured, oh, we don't have it pictured.
Says it's ready to.
Okay, we'll just stand by. Does the web audience have the PowerPoint up?
Web audience can
We're
see it.
good? Okay. Well, you guys have it on the papers, and then if you don't mind, do you mind getting on the ground? So the bridge, she's laying down on her back. Her knees are about hip distance apart. Her feet are hip distance apart. And she's simply lifting up her hips and pelvis up to the ceiling and down. So she's got to squeeze her glutes as she comes up and then lowering herself down, nice, slow, and controlled. The other one listed is a clamshell, excuse me. So she's on her side, and her knees are bent, and her top hand is pressing down against the ground, and that helps stabilize the core, turns it on. So I always think of like smushing a bug, pushing down. She's rotating the top leg up towards the ceiling without having a major pelvic rock. So do it incorrectly where she's rocking the whole leg back. That's not a clamshell. We want to isolate it at the hip. That's our rotational point, and our feet are staying together. So these two exercises are really good basic exercises for getting increased glute strength. Okay.
Just keep talking, we'll get there.
Another great glute exercise is side steps, and this is an important exercise for strengthening the outsides of the hips. And without a band, Ashby can show you. So she's taking big steps out to the side, keeping her feet parallel, facing forward. Her hips are back, and she's, if she had a band on, she's stretching the band out. You can put the band around the ankles or the knees, and you can see how that can create some resistance for her. Okay? Beautiful side steps. Squats. So this is the foundation, I think, for every sport. You got to have a great squat technique. So also, we look at squats as an assessment of how an athlete is moving. If they're coming in and they're squatting and their knees are buckling in, or if they're, I call it the elevator, where they're just kind of going straight down, that's horrible technique. And we'll look at some of those pictures later. But a volleyball player should be able to jump and squat and balance without pain. So if the player's going into a squat and they have pain, we have an issue. That's not normal, okay? So can we go to the next one?
It says it's sharing the slides with you.
So for people that are tuning in on the web, we're having some technical difficulties with our PowerPoint. Do you want me to pause?
No, keep going.
Okay. So next, since you guys have Ashby, everything that, oh, there, we have something.
Now we have it.
Okay. And so was I at 29 or 30?
And now we don't have it.
Okay. So with, let's go to that one. So, so to show proper squat form, can you turn out laterally? And so for a proper squat, her head is facing forward, her back stays straight, her abdominals are contracting, her knees are coming forward towards me like headlights, and her feet are parallel. Another great assessment and exercise is a single leg squat. So a single leg squat tells me a lot as well of what could be going on, so you can face them. So she'll do a proper single leg squat, so she's got really good technique. Her knee is going towards her third toe. That's a great visual, is that the knee is going towards the third toe, not buck. Do you want to do a bad one? Be careful. That's where her knee's buckling in, okay? That's bad. When the knee is heading towards the first toe. A lot of times that's happening because they're not activating their glutes enough. There should be a hip hinge, and her abs are tight as well. So that's a great, great exercise to work on single leg stability is the single leg squat. And Ashby demonstrated the bad single leg squat. So, as I was mentioning, you can sit. Thank you, Ashby. There are some really great stretches you should be doing after volleyball. And pictured here, I've got the first one here is a hip flexor stretch. So she's got her leg up on a wall. She's stretching her left hip flexor here, but she's also stretching out her quad muscle. So these muscles will get tight because they're in a shortened state during a volleyball game. So it's really important to stretch that muscle. The second one, the middle one, she's stretching out her calf muscle. So she's in a nice lunge position, and her heel is down. When she's stretching her calf, she can actually get a little bit of a hip flexor stretch in the front there as well. The next, oh man. The next picture, go ahead, stand up, is going to be a quad stretch. So it's just a standing quad stretch. She could hold something for support, of course. But the thing with this one is that it's really good to get her knee back. So then she's getting more of a quad stretch. If she brings her knee forward a bit, she's not getting as much of a stretch there, okay? And then next one, you don't have to do that one, is the hamstring stretch. So you can either use I like to use a long towel or belt around my leg, and then I'll bring it up. Or she's got an outside corner here, so her leg is up against the wall, stretching the back of her thigh. Then the last picture there is a piriformis, or kind of a deep gluteal stretch, and we call this a figure 4 stretch as well. Okay, so I mentioned video motion analysis, which I absolutely love using. We do lots of different tests over at Motion Analysis, and I feel like I should have the expert, since she's here, our tech, discuss a little bit about motion analysis and how to get your athlete into motion.
Just as soon as we transfer the microphone. All right, my name's Chrissy. I'm the motion analysis technician here for Children's Hospital, UCSF Benioff Children's Hospital, Sports Medicine Center for Young Athletes. It's a title.
That's a title.
So our motion analysis lab is located in our Walnut Creek campus. We have a very large facility out there. We are able to do preventive testing. We are able to test those athletes who are currently in physical therapy. We do clinics such as the Runners Clinic every month to have athletes from the community come in and get a look, see if there's something in their form that just needs to be fixed. We have state-of-the-art equipment. We have full 3D capability. We also can synchronize our video cameras with force plates in the floor to see how much pressure is going through your knee at what point. So as soon as you step on our force plates, we can see how much pressure is going through your joints. Not only that, but we can visually see exactly when your knee buckles or doesn't buckle. So it's really phenomenal information.
Cool. Great. Thank you so much, Chrissy. I appreciate that. Oh, and then it's down again. But yeah, I wanted to show. So that's what Chrissy was talking about, where the athlete here is landing on those force plates. And so the physical therapist who analyzes the data can take a look at this and look at the athlete's pre-landing, landing, takeoff, look at these angles. They put little sticker markers on the joints. It's pretty cool.
That's just one of the tests that we're able to do.
Yeah, and that's just one of the tests that they are able to do. And So again, we could then have some pre-data and post-data of looking at landing techniques and then being able to train the athlete. I don't think it's showing it. So my pre-testing picture is athlete buckling in, knees are collapsing, they're not approaching the jump with proper hip control, and then after us working, being able to get them with their hips back, knees forward. And all of this sounds very simple, me just saying, oh, rattling this off, what Ashby just demonstrated of bringing your hips back. All of that seems simple, but then when you actually apply it, it's a little bit more difficult. You have to acquire and practice this neuromuscular control. So neuromuscular control, what I mean by that is the communication between what your brain is telling your muscles and your body and where to go. So again, it looks easy of, okay, I'm doing a single leg squat, that's easy, but you try it, and if you are you coming back from an injury, it's not going to be normal. And so it takes a lot of time and practice, and that's why we, the physical therapists, are here as the movement experts, and they've got the motion analysis, because then we're able to break things down a little bit more and actually add numbers to things. And sometimes it's great to have information to give the coaches and teachers to show them, hey, look at what's happening with this athlete. So my next slide that you guys can't see is our jump program. So in physical therapy, I teach a jump program when it's an appropriate time to my athletes who jump. And this should only be done in a trained setting by somebody who is a physical therapist, physical therapy assistant, athletic trainer. That's why I did not include it in the folder, but I just wanted to let you guys know that coming into physical therapy isn't just me giving you a bunch of clamshells and bridges exercise. We do higher level performance analysis and training. So the jump program is a 6-week program that has many, I think it's 7 jumps, 8 jumps, about 7 jumps each week, and some of them either get harder and more difficult because you're doing it for a longer amount of time, or we introduce a new jump. So I think in week 3 we start introducing new jumps. So it starts with the jump program. Each jump is performed for about 20 seconds, or it will base it off of the amount that they're doing. So most of them are timed. I'm so sorry you guys don't have the picture of what's listed, but we have Ashby, and so she's going to demonstrate what week 1 would look like if she comes into the clinic, and I'm teaching her week 1. So she's going to show what week 1 would look like. So I would start a timer. She would start with what's called wall jumps. So wall jumps, you can just tap in front of me here. So pretend there's a wall here. I'm a wall. So she's going to try to tap up as high as she can. She's starting with her knees in a bent position and landing with the knees in a bent position. It's a small jump, and that's a great jump to start with. And we do it for 20 seconds. And then after that, I do give a 30-second break. So they're not going from jump to jump. The second jump, this is a hard one, is called a tuck jump. And so what she'll do is she's going to tuck both of her knees up, and they are going up to hip level. So this is a very difficult jump, and Ashby's making it look incredibly easy, but it takes a lot of training. So again, she would do that for, I think that was 20 seconds, 30-second break, and then she'll do jump squats, and it's about 10 seconds for the jump squat. So a jump squat, she's going down into a nice squat position and then jumping as high as she can up for vertical. Next one are barrier jumps. I didn't bring a barrier since you can't see her legs anyway, but what she would do is she would be jumping forward and backward over a barrier. So then that's another variable that you can make harder on an athlete. I can have her jump up something that's maybe 4 inches high, and then she's jumping back and forth over that. Same barrier, we would have her do a side jump, so she's jumping back and forth. Again, as she's going through these jumps, I'm not just giving these to torture her and getting her to sweat. I'm also giving this as an analysis, so I'm looking and assessing how she's moving during these jumps, and I'm giving her constant cues of maybe her landing, maybe her knees, maybe she's turning, That's why it should be done in a safe setting by a trained professional. The next one after barrier jumps are broad jumps. Do you remember the broad jumps? Yeah. So she's going to start with 2 feet, and then she's going to just jump forward and then land. And I like to have them hold for about 3 seconds. Hold for 3 seconds. So that's just a jumping forward for distance, and then she's got to hold and land and making sure her knees aren't buckling in. The next one is called a 180 jump. This one's my favorite jump. So she's going to start in a mini squat position, and then she's going to do a 180 turn, and then she's going to turn back. So she just constantly just goes left, right, never a full circle. That's, again, for about 20 seconds, 30-second break, and then the last one is bounding. So the first bounding of this one.
Oh, the small one?
Yeah, the small one. For week 1, we start them bounding, going lateral. So she's doing a big lateral hop. As she does it, she's going faster, higher, higher, go, faster. And that's what bounding is. Later on, I teach bounding where she's doing it as a run. So she'll start at one end, and then she's jumping, leaping diagonal, trying to get higher and further for each jump. So that's the example. Oh, yay! I'm so sorry for the technical difficulties, but those are the ones that we just, that Ashby just demonstrated right through there. And again, this should be taught under the supervision of a trained professional. So if I give this as homework, she's going to be doing it 3 times a week. What's that?
Just keep going.
Okay. So in conclusion, volleyball players put a lot of stress on their body performing their sport. Specific emphasis should be placed on stabilizing the ankle, knee, back, shoulder for volleyball players. One other component I wanted to touch base on was also balance. So we talked about ankle sprains. When you're rehabbing an ankle sprain, balance is a key component. So being able to stand on one leg. You got to be able to do this before we start those single leg squats, as I have included in your folder for the exercises that are my take-home homework for everybody. So strength, flexibility, and proper movement patterns are important for running, jumping, and movement efficiency and reducing the risk of injury. And lastly, a few simple exercises and drills can help you be more effective volleyball player, which is what we all want. Are there any questions? Yes, go ahead.
The taping, is that good for both to prevent an injury and also for after an injury?
So the question is regarding taping and if it is good to use before or after an injury in terms of preventing an injury or after an injury. It's a great question, and to be honest, on a evidence side of studies, there's nothing that's been concluded. But I would say I think it's great to use in terms of coming back from an injury. I don't think I would ever put tape on somebody just as saying, oh, you know, Chrissy's going to go play volleyball and I'm going to tape her shoulder just to prevent, even though she's got no pain or no issues ever with that shoulder. I would not put tape on an athlete just for prevention. If she had a history of maybe a little rotator cuff injury, I could take the shoulder and it might feel like it's easing some of those stresses and providing a little bit of proprioceptive input if she can feel that tape on there, and it might be slinging or giving it a little more support. So I would say taping would be more appropriate after an injury.
I have an online question.
Okay, so online question is, what are some ankle warm-ups for after an ankle roll? So that's a really interesting question. After an ankle roll, or what I think she's implying, an ankle sprain, there are so many different levels of an ankle sprain because an ankle sprain could vary in severity. So it could just be an ankle roll, and if that's what she's implying, just a small little roll, just being able to do little circles or doing an alphabet, trying to spell out your name is fun. Any kind of little ankle movements is good. Trying to not put too much weight through that joint, initially speaking, is important. Because if you're loading that joint and you're walking and jumping and running on that ankle after an injury and it's swollen, you're going to just cause further injury and to that ankle. So in terms of proper warm-ups, I would actually say that the dynamic warm-up does help with if you're coming back and you're out of the acute phase of an injury and you're able to bear weight through it and you've been assessed, you're able to move without pain. I would say the dynamic warm-up is excellent for warming up not just the ankles but the knees, the hips. It's a whole body warm-up. So that's a great question. Thank you for your question. Any other online questions, or anybody here have any more questions? Yes, go ahead.
Yes, what type of braces would you recommend in injuries, like as far as thickness or name brands?
You know, I really don't have any specific one that I would recommend because there's so many that vary and people would use a brace for different reasons. So some people like to just wear a small sleeve and they like that because they have a little bit more movement. After a pretty bad ankle sprain, what most of my athletes would get issued is a lace-up ankle brace that they would get from one of our orthopedists here. It laces up and then it has two Velcro straps that come around and crisscross, and that provides pretty good stability. So I really like that lace-up brace personally after the ankle sprain, and that tends to be issued by the orthopedists. The main thing with ankle braces is if it's comfortable for the athlete to wear and they like the feeling of it, then to me that's the best one for them. That's the same with like arch supports. You know, I can't say, oh, the Superfeet are the best or any brand name. I would say whatever they find most comfortable for them, it would be the best. There shouldn't be blistering or redness or anything. That means there's some type of friction point. So that's what I recommend.
Should everyone who has a roll wear a brace when they play?
I would honestly discourage, I couldn't make a blanket statement like that in terms of if you've ever had an ankle sprain or roll, you should be wearing a brace. If anything, I would actually discourage using it and feeling like you have to rely on it. It's definitely great to brace or tape if you're coming back from having an injury. And again, definitely don't brace or tape if you're trying to prevent. But you shouldn't feel like, if you feel like you have to rely on it or you're playing through pain, then you have an issue. So if you feel like the only way I can play is wearing this brace or else I'm going to have pain, then you need to come see me, okay? Yes?
Oh, I had two questions.
Go ahead.
One is you were mentioning about the ankle rolling.
Yes.
Dynamic movements. What did you mean by that? Or dynamic?
So the online question was having to do with warming up the ankle properly, I think, after an ankle roll. And so my answer was that it depends on what stage we're talking about. If it's an inflammatory stage with ankle swelling, of having a patient elevate their legs, they can do ankle pumps or ankle dorsiflexion, plantar flexion. They can also begin to get ankle ABCs. I'll have them moving out the ABCs out with their foot. Once they're able to bear weight pain-free, I would then have them warm up with what Ashby showed, the dynamic warm-up. And if that's too much, then we tone it down. So it really just depends on where they're at. But we want to restore proper range of motion to the ankle, but it should be not forced. It shouldn't be painful. They should be able to begin range of motion in a pain-free range and then progress from there. What was your second one?
Well, now 3. So the dynamic warm-up, that slide that you had, there was 6 or 7. I don't think that's in here. I didn't see that in the.
Oh, okay, I can definitely. The question was about including the dynamic warm-up in the folder, and I may have left that out. So I think I've got copies in the clinic.
If you want a copy, email me at sportsmedicine@mail.cho.org, and I will send you a PDF version of that.
And then the final question
Yes.
about taping. I've seen, you see like packages of sports tape at like Target, and they'll have different like full colors and stuff. But I have no idea how to apply them. Can you provide some advice on that kind of, how would you apply if you have to?
Yeah. So the question has to do with the different types of colorful tapes that are out at sporting goods stores, rock tape, KT tape, kinesio tape. And so the question is advice on how to apply it. It really is great I love to use online, and you just have to be careful of what resources you're going to. There's tons of great instructional videos out. There tends to be an instruction manual. They have a paper that has some of the basic tapings, or you can come in, and see a physical therapist or an athletic trainer and have somebody that's trained in taping show you. That would be the best. I don't think that's always the most convenient. So that's why I'm saying online. But of course, my disclaimer is be careful of what you find online. Make sure it's a credible source. And the other thing is with taping, most taping that you can buy out at a store comes pre-cut, and the edges are curved. If they're not, and you have to cut it as you go, you want to make sure that you curve the edges. The other piece of advice would be to never apply pull or tension to the ends once you're applying the tape. The middle section can be pulled, but if you're putting tape down, it should just be flat without any stretch, because if you apply stretch, it can cause redness and blistering. But definitely look at the online sources. Maybe go to the websites. I'm sure like Rock Tape, Kinesio Tape, KT Tape, on their websites. I'm sure they should have it. I'm not 100% sure, but I'm guessing that they would have better resources.
We also have a number of athletic trainers in the schools in the area, so check with your school and find out if you have an athletic trainer at your school who can help you out with that.
Definitely. And another question?
Yep. We got one more online. She's in line first.
Okay, go ahead. Is there anything you can do to prevent overuse injuries of the rotator cuff? So in terms of preventing an overuse injury, the best advice I would give is don't overuse it. Rest is very, very, very important. A lot of coaches, or the demands of a season, may be more than what your child, your athlete can endure. And if there's pain, that's not normal. As an athlete they're young and they're growing, they may need some time to rest. So during the time of growing pains and they're just kind of sluggish, they're having all these general diffuse aches and pains, that's not just them being a teenager, they could be growing. That's the time that they really need to rest. So overuse injuries are prevented by not overusing. In terms of overusing the rotator cuff specifically, I would also look at posture and mechanics. So what's their posture during the day? Is when the volleyball player's in class, is she sitting slumped down and not thinking about her posture? So that can definitely affect, is she playing Pokemon Go, he or she, and also what their mechanics are. So an overuse injury can get exacerbated and worse if the athlete is going through movements in poor technique. So that would be my answer in terms of prevention of an overuse injury. Let me take her in the back first.
I have two questions. The first one is for setters, are there any proper wrist exercises for wrist strengthening?
Yeah, there's definitely great. That's a wonderful question. The question was about setters and needing a bit of extra wrist stability and strength, and being able to have certain exercises for their wrists. There are some great basic exercises for the wrist. Would be just taking anything less, than like 2-3 pounds, nothing too heavy. Being able to do wrist curls, wrist extensions. Those are going to help strengthen the forearm, along with supination and pronation. So I can give them like a hammer and they can go palm up and palm down. That can strengthen the wrist as well. Also, the wrist, though, it's not just stabilizing the wrist and doing these small little movements. It's also coming from the shoulder. So making sure, as a setter, I'd want to make sure that their shoulder blades and back are also strong. So rotator cuff, back muscles, maybe doing rows, lat pull-down exercises, things to strengthen their back, because if they're setting and they're tipping their shoulder blades, that can also cause injury, or even if they're doing a lot of hyperextension, that can cause other injuries. But great question.
Did you have another?
question.
Oh, I'm sorry, go ahead.
For your lower back, are there any proper stretching for just stretching out the lower back?
Yes, there's lots of great stretches for the low back. I did not include all of them, but I would probably address that maybe with a physical therapist. I don't want to give out stretches not knowing if there's a certain impairment, but you definitely want to stretch out. I would say the things that you want to include in stretching is some type of a forward position, being able to stretch out your lats. Some type of a rotation is also good. Twisting position could be good. But again, all of these should be given to just in a safe manner. I don't want to just give out stretches. Same thing with the exercises. If any of these exercises cause pain or discomfort, you shouldn't be doing them. So, and it should be further assessed. But definitely stretching out the back is very important as well. Great question.
And how much is too much concerning practice and training in any one given week? Like, let's say on a Monday someone has 5 hours and the next day they have 2.
So the question is, how much is too much in terms of overuse and overtraining? One of our standards is looking at the athlete's age, and that needs to be the amount that they do per week. So if it is a 12-year-old, the max that they should do per week is 12 hours per week. So if they're exceeding that, then they're definitely overusing. With that said, if I have a 16-year-old and he or she is only practicing and playing volleyball maybe 5-6 hours a week, but they're going through a growth spurt and they're having pain, then that's too much. So everyone's different. There is unfortunately no major magical number, especially when we're dealing with the different vulnerabilities for the young athlete. But our go-to criteria would be the amount of hours per week should not exceed their age. Any other questions? Great. And anything on the web? And oh, yes, we have a great audience. Well, thank you so much for coming out tonight. I really appreciate it. And my business cards are in the folder. And have a wonderful evening, everyone.
And Connie says thanks.